You can't have become a doctor if you hadn't done your internship. For the general public, just know that we can't have enough doctors in the country to give the patient a competitive advantage of choice if we don't produce enough doctors. And we can't have enough doctors, as I've started, if we don't have interns completing the internships on time. My name is Dr. Abidan Mwachi. I'm the National Chairperson of the Kenya Medical Practitioners and Dentist Union, KMPDU, the most consequential union in the land today. What is internship for the medical people? Internship involves a period of time in between completion of medical school and the commencement of actual practice. That is to say, after the 5 or 6 years, if you're lucky, some may even take 9 years for unfortunate universities that we may all have heard of in the media that took 9 to 10 years to complete the coursework. So during internship, an intern is supposed to receive the patient at the first stop point, clerk the patient, diagnose the patient, send for necessary investigations, manage the patient, and sometimes call to get superior or alternative or confirm the diagnosis. After that, admit. In addition, they're supposed to follow up these patients in the ward, do the daily maintenance, daily management of the patient, and discharge. At discharge, write the discharge summaries and manage the patients in the clinics. That is to say, they know more or less do the work of the actual doctor under supervision. And supervision, you'd say, with the acute shortage of doctors in Kenya, your guess is as good as mine. Now, there are two arms that interact quite antagonistically in this whole internship debacle. That is why year in, year out, you get the same problems as akin to a situation where the systems and structures are not there. Or if they're there, they're working in coordinates. There is a Minister of Health that is in charge of policy, and then there is the regulatory bodies, the Kenya Medical Practitioners and Dentist Council, Pharmacist and Poisons Board. On the other hand, we have the ministry that is supposed to budget and allocate interns and make sure that they are paid. It is the Ministry of Health, which is the mother ministry even for the regulatory bodies. So it's the umbrella body that covers the entire internship debacle, and so the buck stops with that. Now, in good systems and structures, the left hand is supposed to know what the right hand is doing. Let me surprise you that, unbeknownst to many, the Ministry of Health seems not to be aware of the number of medical schools that these regulatory bodies that I mentioned on my right, KMPDC and PPP, are authorizing to produce medical doctors. And if they know, the Ministry of Health sits on its stable hands up until the time when there's strife, at around the time when interns are supposed to be posted, like now. And so they rush and jump out in quick cacophony with a lot of motion but no movement, pretending to solve a crisis that they should have anticipated. And that is the crisis of posting interns, finding slots for interns, posting them, and paying them as per our CBA. Highlight CBA. Highlight CBA 2017. Now, in so doing, we have interns waiting for months, sometimes years on end, for posting to serve Kenyans, one, and for them to get the requisite regulatory papers that if the country does not want them, they can abort and go offer their services elsewhere. Without that internship period, interns are basically just as they were after completing the secondary school education with no papers whatsoever. Trust me, the degree doesn't count. Now, year in, year out, we get a ministry that is quite out of sync with the regulatory bodies. And so the budgets are usually like historical budgets, not the budget for the actual number of doctors that have graduated, actual number of doctors that had been anticipated. And this year, 2025, is no different. We have a cohort of interns that have stayed out there in the cold, marinating, some for even more than 8 months. This is sad. In a country where you, the healthcare receiver, will wait for hours on end to receive treatment. What does it say about universal health coverage? Universal health coverage, basically the concept is about the most vulnerable in society, mostly receiving healthcare without hardship. And this is economic hardship and also quote unquote human resource hardship. We need to join into this debate about government posting interns on time so that they free up the specialists who would, in that circumstances, be forced to do internship work. So that these specialists are freed up to perform specialist duties. Can you imagine a specialist who is supposed to focus on giving cancer treatment, dedicating his long hours trying to fix a line or do the basic lab works? After years of a career progression, after years of getting an education from yourselves, that is both wrong as it is immoral. In the coming few days, we're going to hear a lot of noise from the interns, of course supported in full by the union, that their posting needs to be done immediately. Where immediately means now, and we're now